The next speaker will be Dr. Yoshiaki Omura of originally Japan. Now he practices in New York City. It's rather unusual to hear from a doctor whose major practice consists of only those people who are referrals from other doctors. Most of his practice, then, you could say, you couldn't, but I can, from other doctors' failures. We're also indebted to Dr. Omura for being with us at this Congress. He postponed another 4 or more day symposium that he will be lecturing at for that long to physicians only in Tokyo, Japan, which will be shortly after this Congress. It was scheduled during these same dates, but when we got together early last fall, he did whatever he did, and he got that symposium postponed another week so he could be with us. So we're indebted tonight to him and proud to present Dr. Omura from New York City, where his practice is now. Welcome, Dr. Omura, tonight, please.
Thank you very much, Mr. Stonia. Now, before I start, I would like to first introduce Gloria Bibo, who introduced me to Mr. Dean Stonia. And also, Gloria, why don't you stand up?
Thank you.
And also, Sandra Beckman, who kind enough to come here to help me for demonstration. Sandra? Now, subject I'm going to talk about is probably you are not familiar, but the symptoms are a very common symptom, and the whole thing started. I'm also a physician, and I was trained at Columbia University Cancer Institute and in Department of Surgery. Essentially, I was a cancer surgeon, and also I'm an electrical engineer and a physicist. But only things I don't do is that surgery. That's the only things I don't do, but that's the most time I spend because we can help the people without cutting, and in most of the cases. Also I was involved in so-called first successful surgery using acupuncture in the United States in 1973, a few months after the President Nixon came back from China. This was done at Albert Einstein College of Medicine. And because of that, I was asked to explain from medical profession why acupuncture works. And then from public, they asked me to treat all kinds of disease because public has a misconception that acupuncture mysteriously can cure all kinds of medical problem. And but just like any treatment, they have a limitation and indications. Now, the story I'm going to talk about, the cephalic hypotension syndrome, is characterized by difficulty in concentration, easy forgetfulness of recent events, and irritability, insomnia, and increased sensitivity for pain, and muscle spasticity in the neck and shoulder area. These are some of the characteristic syndrome. And when you go to the doctor with this syndrome, often you are probably given tranquilizers and sleeping pill. As a result, your symptoms become even worse. And usually you end up either psychiatrist or acupuncturist. And you may, if you're lucky, you may have an improvement, but if you get some treatment, particularly either tranquilizer or sleeping pill, what the physician prescribe you is amount of the dose they prescribe, regardless of your age, the more or less you get the same amount of the medication. So if you are advanced age, I used to think anybody over 60 is advanced age, but when you become a 60, you're no longer considered to be advanced age. So but there is a distinctive change take place if anybody over 70, their blood circulation to the liver, kidney, lung, and all this blood circulation diminishes to almost half of the normal adult. So if you give the same amount of the medication, first 1 or 2 days will be all right. But within a few days, they cannot excrete all the medication because the circulation is reduced to half. But if you give the same amount of the medication, you get overdosed and you will develop the intoxication. But most of the doctor may not recognize this. And then you are getting already within a few days, you will develop the toxicity of the overdose of the medication. Another, what I'm trying to tell you is that medication over 70 years old often amount reduces significantly, up to half of the normal adult dose. And now this story started while I was I'm still, but I started this journal called Acupuncture and Electrotherapeutics Research, the international journal. I have been editor-in-chief and for the past 21 years. And around 1975, or I can't remember when it was, a long time ago, I was visiting Dr. Joseph Needham. He's a well-known historian at Cambridge University in England. And he and I had a appointment to see his library in Cambridge. And I was daytime. The previous day I was busy with meeting some of the professors at Oxford University, and I just if I don't take the last bus, I cannot make this appointment. So I took the last bus, but I did not have time to eat whole day. I was so hungry. And as soon as I arrived in the Cambridge, I went to the hotel and I found out there is no restaurant opened after 10 p.m. unless you go to the center of the town. So I went to the center of the town and ate my dinner, and I came back. And just near the hotel, some young man asked me, "What time is it?" So I saw watch. I said 11:30. Next thing, they are choking me with a knife and holding one hand with a knife. And since I do also judo and karate, and one person was no problem, but I found out there is a 3 person, and And one has a knife, other one has a sticks, And so eventually, I was knocked down by one of them throw a big stone on my head. So I become unconscious. And then somebody driving there, they saw, immediately they picked me up, brought me to Cambridge University Hospital. And these three young persons was later on, within a few hours they were caught, and they were British soldiers. They went to Cambridge to sightseeing, and they missed the last train, and they have no money to go back in time to their camp. So there, I was wearing the brand new clothes and the cameras and the eyeglass. It's a typical, Japanese style, So they thought, I must have a lot of money, which they made a mistake, And they took everything I had, but they were caught, And so when I was put into the Cambridge hospital, there was a young neurosurgeon, he's a resident, came, and he said he's going to do the angiograph. So I asked him, how many cases did you do? He said, this is the first time. So I become nervous. And, and I said, myself, if I stay here, I may end up dead in here, And at least, probably I better leave the hospital as quick as possible. And so I signed the release that I will not blame or anything I'm doing with my own responsibility. And the next morning I met with Dr. Joseph Newsham after I finished my appointment, and I returned to New York, and I had a headache, I have a fracture of the nose, and part of the scalp, and anyway, that time, I had experienced almost like when I was getting unconscious, I saw the whole of my life like a screen, played on the like a movie, going back whole life, And when I came to around, I think 4 or 5 years old, I had some experience. I remember I was in Tokyo, and at that time, this man wake me up and brought me to the hospital. And so after I came back to New York, since I was trained at the Columbia University Medical Center, and I also received my Doctor of Science degree from Columbia University, so I have many friends. So I decided to discuss, some of the authority in the field, and essentially what I found was there is no authority in this field. And so I went to the library and tried to find out what kind of research has been done. And nobody seems to know even the normal blood pressure in the head. And so there is nothing, abnormal blood pressure, and particularly measurement of blood pressure in the head. And they all describe the blood pressure normal and abnormal in the arm, but nobody described how much was on the patient blood pressure. But they are all presuming, with the blood pressure is high in the arm, you presume blood pressure is high in the head. And so I immediately realized that I would like to find out how much is the blood pressure and blood flow in my head. But to do that, the standard method those days was puncture the scalp with drill, and doing rather traumatic approach, and that is, absolutely, undesirable. So essentially, what I did was that, I developed an instrument, which eventually I got a U.S. and Japanese patent to measuring blood pressure in the brain non-invasively. So using this, we start measuring, my blood pressure on the head, and by that time, we start measuring all kinds of the people's blood pressure in the head, and then we found there is a distinctive symptoms associated with abnormal blood pressure in the head, and that may have nothing to do with the blood pressure you measured in the arm. And they have a, they have two types of the abnormal blood pressure. One is a high blood pressure in the head. We call cephalic hypertension, and cephalic hypertension, and the other one is very low in the head, cephalic hypotension. And we found about 10 or 20% of the people have experienced cephalic hypotension syndrome, which I mentioned to you, all the series of the symptoms. And in spite of such a common problem, nobody even knew about this. And not only that, some people have a completely normal blood pressure in the arm, but blood pressure in the head is very abnormally low or high. So I just will briefly explain what. So what I do is that I measure the blood pressure in the arm, and at radial artery at the level of the aortic valve level, and this I make as a control. And so you have to keep the arm about equivalent of the specific location of the heart, and then you measure the blood pressure, and then you compare with the blood pressure in the head and also lower extremity. And so I used to measure the ankle and also big toe. So you measure the blood pressure in the head, and first measure the arm, and then the head and ankle and big toe. And so this is become my standard blood pressure measurement in the patient. And then we start finding, all kinds of things which has never described in anywhere. And also measurement of the blood pressure in the arm is, does not indicate anything about the blood pressure in the head or lower extremity. And I'll tell you what will happen if the blood pressure in the head exceeds 170 millimeter mercury. They all develop the headache, only that side of the head. And this high blood pressure in the head can be either one side or can be both sides. But we sometimes see one side is very high, one side is very low blood pressure. So sometimes, this mixed, hypertension and hypotension. So the symptom is accordingly different. And so one day, I was invited to give a lecture to University of Paris. They have a hypertension institute. And all the professors and the researchers was listening. I asked the, simple question. What do you think the blood pressure in the head is it the same with the arm, or is it higher, or is it lower? We found 3 different opinions. This is a specialist, So you can imagine, rest of the people, In other words, they have no clear idea. And but we found actually it was a very simple physics, and we can estimate normal blood pressure in the head or any part of the body before you measure, as long as you know how much is in the arm, provided the rest of the body is normal. We found every 10 centimeter goes up, blood pressure goes down 7.7 millimeter mercury. and every 10 centimeter go down below the aortic valve level, the blood pressure goes up 7.7 millimeter mercury. So you can measure the distance from the heart level. You can estimate how much blood pressure you should have in the normal person. So that before you measurement, you estimate, and then you compare, and if it measured value is much lower than the estimated normal value, then you consider it is hypotension of that particular part of the body. And now I'm going to explain why some of the symptoms I mentioned will appear. Now this is a slice of the human brain. It's sliced, like this, front to back, but not in the midline, slightly off-centered. And this area is called pons. And this area is called medulla oblongata. And this is a cerebellum. And this is a hypothalamus. And you see this red colored area? These are the distribution of the neurotransmitter called serotonin. Are you familiar with the serotonin? Yeah. It's a distribution of the serotonin in the brain, and most extensive secretion is occur in this area, in the pons, and this is called nucleus raphe magnus. And the serotonin have a following characteristic. It controls the sleep and wake pattern. Not only pineal gland, and the serotonin also influences, and also pain. They reduce the pain. They modulate the pain. So when it reduces, the secretion reduces, you have a increased.
Can you speak a little louder?
Louder.
Louder.
Can you put up this microphone? No, we can't understand.
Well, I'm sorry if you don't understand. That's the best I can do.
Better. That was better. Yeah, we can hear now.
Okay, anyway, so serotonin it controls the pain and also mood. And when the serotonin secretion diminishes, then you have irritability. And also serotonin, this is a nucleus raphe magnus. The both side of this nucleus, there is another nucleus called nucleus reticularis gigantocellularis. They control the muscle tone. Usually, when the circulation in this area, medulla oblongata and the pons and the hypothalamus, when the circulation diminishes in this area, always this nucleus reticularis gigantocellularis circulation also diminishes. Then what's going to happen is that muscle becomes spastic or tight. And so all the symptoms I mentioned will appear. And now, one of the most common cause of these are common cause of the cephalic hypotension syndrome is a decrease in the blood flow to from the vertebral artery to the base of the brain. And these are often associated with a certain profession, like some of the conductor in the philharmonies. And some conductor, when they do this, they separate movement of the head and the body, and some move body and head together. These people don't develop this. And those who movement is separate, head and body movement is different, separated, they often develop this cephalic hypotension syndrome because sudden movement of the vertebral artery, which goes from the foramen, transverse foramen in the cervical vertebra, and then go to the base of the skull. There's each side one artery, each one vertebral artery, and they go to enter the base of the skull, and they form one artery called the basilar artery. And this basilar artery supplies the blood circulation on this area. And so sudden movement of the twisting is produced vasoconstriction, and that creates decreased circulation in the brain, which reduces all these symptoms of cephalic hypotension syndrome. And also another one we often find is a dentist or anesthesiologist. They always put the head like this, and also taxi driver. Suddenly you have to twist the head to see, and so these are certain professional people develop this. And I will show you some of the example of the. Now, this gentleman has a macular degeneration, and we cannot measure the blood pressure in the head. That doesn't mean that there is no circulation. Simply, the technique we're using, it's practically zero, but there is a circulation. But when we gave acupuncture or shiatsu in the vertebral artery, near the vertebral artery, the blood pressure goes up. This one 60, no, this one 80, and this one goes to 40 millimeter mercury. And it's normally we found blood pressure in the head is between around, as long as it is between 150 and 50 millimeter mercury, there will be no symptom. But when the blood pressure goes down below 50 or above 150, you start having a symptom. And this gentleman has a retinitis pigmentosa, and after we gave this, we gave him the, I think, electrical stimulation, the blood pressure went from this side from 10 to this side 45 millimeter, and this side 40 millimeter mercury to 50 millimeter mercury. And when this improvement appears, often there is a corresponding improvement in their symptom. Once, now this lady had a very interesting symptom. When she put this is a N is a position of the neck. When she put the head downward, she developed a severe headache on this side. So we measure the blood pressure while she's head down. Blood pressure went up to 260 millimeter mercury. So she has a cephalic hypertension in the right side, but this side go down to 20. Normally it's 60. To go down 20. So by putting head down, left side becomes severe cephalic hypotension, and she has a severe headache this side, and this side has a symptom corresponding to cephalic hypotension syndrome. And these are, we were able to eliminate by variety of methods. And this gentleman had a stroke. He was a policeman in New York City, and blood pressure was this side. His main complaint was a headache. When we examined, was a 200 millimeter mercury in the right side, and the left side is a 60 millimeter, which is within it's low, but still within the normal limit. And after we gave him, I think acupuncture or laser, I can't remember what it was. Blood pressure went up to, right side went down to 110 millimeter mercury, and left side went up to 90 millimeter mercury. These are close to normal. And so if you complain to the doctor, I have a headache, you may end up just getting a pain medicine. That will not do anything, You may be impending a stroke, But, since you don't, and I think his blood pressure in the arm was almost normal, so nobody will suspect, abnormality. Now, this was the most unusual one. This patient was studied at New York University, and they could not figure out his symptom is a stroke, but they never seen the child with stroke. So they sent me to evaluate, and when I examined, we found he had a blood pressure over 200 millimeter mercury in the head. And I have never seen such a high blood pressure in that, I think, about 2 years old child, And so essentially he had a stroke. And he was a conductor in the Paris Philharmonic, and his problem was a double vision. And when I examined, originally it was a 40 this side, and this side was fluctuating between 70 and 60. And this one, we were able to, as soon as we gave acupuncture at near the vertebral artery, which produced a vasodilation of the blood vessel, immediately double vision disappeared, because he was a conductor, and everything, he sees a double vision. Every time he turned the head, it became a double vision. So he quit the job, and shortly after he quit the job, he came. It was too late, We were able to fix, with the first treatment, symptom disappeared, and but already job is gone to some other person. And some people start asking me, how come, blood pressure in the arm is lower? You should have a lower blood pressure in the head. How come you can have a high blood pressure? That you can explain some of the Bernoulli's equation. And this, I'm not going to discuss because we don't have time. Now, what I was explaining was that mostly this artery called this is a vertebral artery. This you have in the both sides of the on the vertebra. There is a side of the vertebra. There is a hole. This artery go through this vertebral transverse foramen, and then from here on, it's the base of the skull, and become one artery called the basilar artery, and this supplies this pons. This medulla oblongata and the pons, and some of the important part of the posterior part of the brain. And so when that circulation diminishes, these things happen. And then there is another artery in the front, this carotid artery, and that also supplies also circulation in the eye and base of the brain, and there is a vascular ring called circle of Willis, and they are connected. These come from internal carotid artery. This come from the neck. So you have two arteries coming from outside of the brain. One come from here, front. This is a carotid artery, internal carotid artery. Other one is from the back of the side of the neck, the vertebral artery. So when these have a problem, you will have this cephalic hypertension or hypotension syndrome. Okay, now go to the next slide. Now I'm going to discuss something else. I'm trying to explain some of the common problem, this which is often very few doctors studied. Now this is a method I developed called the bi-digital O-ring test, and often this is abbreviated, and many people call O-ring test, and in Europe they call Omura test, and Europe and Japan. And this bi-digital O-ring test, using this without knowing anything about the patient, we can localize the exact location of the abnormality, what is causing that abnormality, whether it is a bacteria, virus, or circulatory disturbance, or malignant tumor, or the drug is reaching certain part, and also without using X-ray or MRI, we can even map the outline of the internal organ without any high-tech instrument. And using this, you can see that these are some of the typical examples. We can map the organ like this. This is a pancreas, and when we map these are larger than the actual size, and then you can find abnormal part of the pancreas and the exact location and what causing abnormality. In this case, she has a severe diabetes, and the blood sugar is between 200 to 300 milligram %, and she has a cytomegalovirus infection in the entire pancreas, and plus Pseudomonas infection, and alpha streptococcus and chlamydia trachomatis mixed infection. And so originally when we discovered these things, by the way, only these are 1988. We were able to do this much earlier than this. Only a few years ago, some of the diabetes specialists confirmed that diabetes has a cytomegalovirus infection, and now become accepted theory. But using this, we know for many years now. And but when we give a medication to all this, there is no improvement happening. And that time we did not know why. But now we have a number of the reasons we found why when we give antibiotics does not work. And then also when we are mapping this organ like stomach, we found always lines coming out from this. And when we followed this line, and this line and the second toe, and also there is a zigzag here, and we found these are essentially it's equivalent of the acupuncture meridian. And then we try to see the exact diameter. We saw the bulging, and that bulging is equivalent of the acupuncture point. So nobody was able to see the acupuncture point or meridian. We are able to we found a number of the mistake exists in the present maps of the acupuncture point. Originally, we thought maybe ancient Chinese imagination, but it's no longer it's imagination. And then several years ago, I published this. This was Helicobacter, which is a major cause of the stomach ulcer. is connected to through lymph channel connected to the heart and producing and go to the SA node, this infection, and producing arrhythmia, irregular heartbeat. And we published this about 5 years ago. And this last year, first time in the British Medical Journal, they are now suspecting Helicobacter may be one of the important cause of the heart problem. Now this was also we are able to detect the Sandra just showed me. I forgotten to mention about treatment of cephalic hypotension syndrome and hypertension syndrome. I don't have time to show now because I'm going to show during the workshop some simple technique. And these are we are able to localize and detect early stage of the cancer using this. Just holding the microscope slide of the specific cancer, if you have an identical substance, it produces a resonance, and this bilateral O-ring test open immediately, and using that, we can make very quickly, screen the presence or absence of the cancers and the specific cancer. But one day we were testing this by the request of one of the professor of surgery at Columbia University. This particular patient had a breast cancer, and in spite of the very small cancer, there was an abnormally broad abnormality we found. And then we found out the reason was that a microscope slide of the cancer tissue contained additional bacterial virus infection. And when the patient has the same bacterial viral infection, they produce a resonance. They also respond, so give the false result. So to solve this, eventually we discovered that in pre-cancer and cancer tissue, we found 6 common parameters coexist. And these are the oncogen C4AB2, integrin alpha-5 beta-1, and mercury in the cell nucleus, increase in the mercury in cell nucleus, and disappearance of acetylcholine and nitric oxide, and viral infection. These 6 parameters coexist. So we're using this, so we don't need to have all the cancer slide to screen the cancer tissue. And so now we use portable laser pointer and can diagnose the people from distance. Just raising a hand, we can make a diagnosis very quickly. And again, this will we demonstrate during the workshop. And this was one of the very well-known physicians who had a backache, and he asked me to give acupuncture. Pain disappeared, but within 4 or 5 hours after acupuncture, pain came back. So I immediately suspected something more serious. And when he asked me to come to his home, when I examined, his bed was in the evening when I went, bed was half sitting position, and I thought bed was bent because to watch the television, but he told me this is the most comfortable position, and so I immediately suspected chronic pancreatitis. So I examined mapped the pancreas. I found this head is rather enlarged. So just to make sure, I checked the using adenocarcinoma of the head of the pancreas, and we found a strong positive. And then I suggested to go to Sloan Kettering Memorial to be examined. They could not find anything wrong, but he was getting so weak and have increased pain and no appetite. They could not discharge. 2 months after the admission, MRI showed a shadow, exact location. They did a biopsy. It was adenocarcinoma of the head of the pancreas, but it's too late. And so he was, although he was a very famous physician, he was discharged immediately to die in the home, at home, and we kept him arriving, kept him additional more than 1 year. But when he was discharged, he was told that his family was told he will not last another 2 weeks. Now this gentleman came from Rio de Janeiro, from Brazil, and he was a graduate of the Stanford University, and he was supposed to succeed his father's shipping business. His father was a very rich, have a rich shipping business. And one day he was swimming at Rio de Janeiro. He was drowned, and he was in a coma in the university hospital 2 weeks. When he came out, his mental state was about 5 years old, and this condition remained about 20 years. And so during that 20 years, he went to 13 most well-known professor of neurology, practically all over the world. And they were all, after taking MRI, they all told that because the brain is shrunk, they cannot do anything. And the brain is atrophied. But when I examined, I found cytomegalovirus infection in this side of the brain. This side of the brain, I found herpes simplex type 1 virus infection, which I found, very common cause of the strokes. And but for these cytomegalovirus and herpes simplex type 1, we discovered using budget rolling tests, mixture of the EPA and the DHA has a very powerful antiviral effect. This we discovered about 10 years ago. So we gave him, but it did not reach the brain. So to deliver the drug to the brain, we gave electrical stimulation. And here you can see the ventricle is enlarged, and the brain is atrophied here. You can see here, right to the empty space here. And because of this, all the professor of neurology, and last one he was examined was a very famous professor at Karolinska Institute in Stockholm. And they spent 2 months with diagnosis and treatment. They essentially told that nothing can be done. So he decided that to go to witch doctor in Peru and Bolivia, and that also failed. And so one of the doctor read my book in Japanese on the budget rolling test, so he came to see me. And so you can see that brain is significantly atrophied, and this ventricle is enlarged. So because of this, he was told that there is nothing can be done. So we gave electrical stimulation and give other antiviral agent. I gave EP and DHA. And about 45 minutes treatment, he started talking normal. And And then this is another typical case. This was several years ago. I was invited to give a lecture at World Congress of Acupuncture at Bulgaria, Sofia, Bulgaria. And I took Air France. My luggage disappeared, never arrived, and I was the first speaker to do the opening lecture. So instead, they wanted me to examine one patient. So they brought one patient, and I asked, what kind of patient? He said, Alzheimer's patient. I said, you know that there's no treatment. They said, that's why we brought. So I said, I'm telling you from the beginning, there's no treatment available. But they insisted for me to examine, just like any other case I examine and treat. So this was a wife of the Bulgarian general, and she go to shopping and buy same clothes in the same day. And so husband is a general, and they have a hard time because she don't remember she bought the same clothes same day. So she buys same things many times because she has no memory of the things happened within 24 hours. But she remember everything happened many years ago. And when I examined, I found this hippocampus area where short-term memory is formed. There's a bacterial and viral infection. So we gave EP and DHA for viral infection, and bacterial infection I gave YS amoxicillin. And but again, the drug is not reaching there. So unless drug reach, nothing's going to happen. So we gave the same stimulation. You see the electrode, and also I checked the blood circulation in the brain. This side was a 65 millimeter, and this side is 80, which is actually low, but it's not so bad. But so the main problem is the infection, both viral and bacterial infection in the hippocampus. And during the meeting, we gave this is the waveform we gave to this stimulator, through the stimulator. Anyway, what happened was that before about 30 or 40 minutes treatment, her short-term memory came back, and I was very curious, and I thought it would probably disappear within 1 or 2 days. So they insist I treat every day. So I gave her every day same treatment. And 1 year later, I got a phone call from Bulgarian embassy from Washington, D.C. Their doctor want to know what treatment I gave 1 year ago. And recently, her short-term memory started disappearing, but it lasted about 1 year.
Do you think the infection came back?
I think so, yeah. And these are some of the Parkinson's disease. We found this caudate nucleus dopamine is missing. This part, this dark area is a dopamine, that's normal. And this area, cytomegalovirus infection is a main infection, and the circulation is diminished. And but if you give the dopamine for this area, it's all right. But this normal area, the dopamine becomes excessive. As a result, you get the toxic effect in the normal part. Abnormal part, it may temporarily help you. So eventually, by continuing, the normal part become abnormal. So these are all present treatment is anti-symptomatic. You're not dealing with a fundamental cause. So eventually, while you are being treated, it becomes worse and worse. Okay, I think Now, this is another case. This is a cardiologist from Boston. He had a stroke about 15 years ago. And in spite of the physiotherapy, no improvement was obtained. When I examined in the brain, we found a herpes simplex type 1 virus infection in this side, and alpha streptococcus infection this side, and there is no acetylcholine in this area. Without acetylcholine, the brain function will not recover. And so, but the physiotherapy is not creating a, it did not do anything for acetylcholine. So we used, we gave a, medication, but did not get in. So we gave a Qigong. We used to give a Qigong directly, but now for the past 6 years, we succeeded putting a Qigong energy in the piece of the paper. So we gave this Qigong energy stored paper, and as soon as we apply on the medulla oblongata, the drug get in. And within 4 days, a family member noticed a significant improvement. And 2 weeks later, he had even the certain, he was originally came from Germany, and after stroke, he could not talk German, even start talking German. And chlamydia trachomatis is one of the major factors in all kinds of program. And they have a specific hiding place, and these I don't have time to discuss. But this patient has Lyme disease, and he went hunting and got a deer, but he noticed a red spot in the side of the abdomen and pain in the neck, and he went to hospital. They confirmed Lyme positive and got antibiotics, but there was no improvement. So they admitted and gave intravenous injection. Still, symptom is getting worse. So they asked me to come to hospital and examine. When I examined, everywhere drug is going except this area where the infection exists. That's the only place drug is not going. So in order to deliver the drug, we used drug uptake enhancement method we discovered within the past 5 years. And you saw the chart on the, Sandra, do you have a chart? Sandra? Can you show me some chart? Can you bring here? Yeah. We discovered that when we stimulate accurate organ representation area, we can selectively deliver the drug in the area the drug never reached before. And so we start using this for the treatment of the cancer and viral infections. And these are the result of our research. We mapped accurate organ representation area. So if we want to stimulate, deliver the drug, say certain organs cancer, so you stimulate that. But unfortunately in the past, this organ representation area was inaccurate. It did not work. You have to stimulate the exact organ representation area. And so you can selectively deliver the drug, effective drug, and you get, so with this patient, I showed where to stimulate. I gave a copy of this map, and immediately after, in his case, in the neck, I gave a Qigong paper. See this piece of the paper? That's not just a regular paper, it's a Qigong energy stored paper, plus Qigong. And you can do that either massage of the specific organ representation area, or you can do the electrical stimulation, or acupuncture, or Qigong, or a number of the methods we discovered. And the gentleman says time is up. I did not have a chance to talk about the electromagnetic field. That is a major things I wanted to talk, but time is up. So during the workshop, I will discuss some of the, we found electromagnetic field is one of the major cause of the contributing factor for cancer and cardiovascular disease. And nobody knew about this. And we can detect and prevent. And many people are dying because they don't know such things exist. Okay, thank you.
Thank you.